Okay, I had the home health care nurse come, Luis. He came in and got me signed up for the home health care, and they wanted to know, I've never had home health care ever, and so they come in, they want to know your discharge date, all of your medications you're taking, your doctor, when you went in, when you went out, what appointments are coming up, who's your health care insurance, etc. And then they wanted to find out what you needed help with. Do you need help with bathing? You need help with changing your clothes? Do you need to have rehabilitation? So they have all sorts of things that they offer. And the only thing I need help with is really just the ostomy, to learn how to change it in the right way and find the right supplies. So we figured out that a home health care nurse, either one nurse he was assigning me to, if she wasn't available, then he would come, and they would help me with that, because I don't need any of the other services that they offer, and they do offer quite a few services. So yeah, that's how they went. He checked my ostomy today to see if it was sealed and how it was, and said, really in the beginning too, it's better not to change it too often if it's sealed. And one thing he told me, that if you're putting out a lot of output, make sure you're taking in enough fluids, because you can become dehydrated. I guess it's like if you have no ostomy and you're having diarrhea or something all the time, you're going to lose fluids. So he said that's one thing to be aware of. Excuse me, trying to get comfortable here. That's one thing to be aware of. So that's good to know, and that makes sense. If you don't have this and you're having a lot of diarrhea, you're going to, okay, so continuing on, that was the VA again. I've got so many appointments, I don't know how I'm going to keep track of them all. I've got to write it down in a book. So they want me to come in and see my primary doctor, which I'll go see her on Tuesday. And I have another appointment somewhere Monday. And so I'm just like inundated, I don't know how I'm going to keep track of all these appointments. I have to make one with the surgeon, with the ostomy care, with the home health care, with my primary physician. I have another one coming up down at the Army Medical Center, that they're taking over some of my care. So it's just, I think a part of my life is just going to be going to appointments for a while. So I've got to get the book out today and start listing them down, because I just, I don't remember all of them. I just don't. So I'll take care of that. But anyway, my primary care is out of town at the moment, and so that's the first one they could get me into. So they want me to come in, right away and see her. So, I'll do that. But, the home health care, anyway, was, he was good, and he looked at all the supplies I had, so he knew what he had to order. And they'll help me to pick a accessory, a device that's going to fit. Now, I never knew this. There are so many companies and so many different ostomy supplies that are out there. It's overwhelming. And he said everybody's shaped differently. And so you have to find the one that works for you, that you can get a good tight seal. So that's basically it. I don't need help with bathing and dressing or therapy or, rehabilitation. I don't need any of those things. Really the main thing I just need is help with figuring out the best ostomy supplies and to get competent in changing it myself and finding out what works, because I can't believe this, there are endless companies and endless types of supplies for this. So that's what happened with the home health care. But I was surprised that they had so many options for people. I'm fortunate that I don't need help with bathing and dressing and, rehabilitation and therapy or any of those things. I just need really just help with the ostomy. And so that should be really kind of a short-term thing. And then again, like I said, I have an appointment set up with the Wound and Care Center for ostomies as well, that will also help me to replace it and learn how to manage that and take care of it. So that's what happened with that. They're very thorough. You have to sign a thing. If something happens to you, do you want to say they came in, you had a heart attack or something, do you want to be resuscitated or not? And, all of those things they have. And you have to give them permission if they need to take a photograph of the area and then release it to the doctors and everything. So you sign a thing for that as well. And so they're very thorough in going over what services you may need, and they give you phone numbers that you can contact somebody if you have any questions on anything. So I feel good about that. I didn't know they had all of that service out there for that type of thing. Now, some people were telling me I should get a hospital bed in here. I can't get in and out of the hospital beds. No, that's a problem. So I do much better with my bed. I just had him lower it, and so now I've got a way to get in and out of it that works. For me, the hospital bed is not an option, okay? For some people, it might be, but in my case, no, it's not really an option for me. So that's what happened with my home health care nurse. He was cool. He said he's got 4 dogs. He's got Chihuahuas, a Jack Russell, and a Lab. So, he's very familiar. But I put the dogs in the other room, just, And of course, Miss Lily was screaming in there because she didn't want to be separated from me. But, just to keep them out of our hair while we were taking care of this. And he did leave me a big book, Amber Care Home Health Admissions book, which is very, very thorough. It's got the number for the Las Cruces. It's got his number, his work number, and the clinical services manager person and office hours and where to call after office hours if you have any questions. And he said, if you're tired at night and you can't sleep, just read some of this. It'll put you out, guaranteed. So anyway, it's kind of all about Medicare, your rights, patients' rights and responsibilities, and all of the information that you need. It's got emergency plans, when to call emergency, etc. And it's got all the names of the affiliate. They have a ton of different nursing services, so it has all of that listed in here. It's got symptoms of diabetes, high blood pressure, all of that. Your EMS, DNR instructions if you want to be revived or not revived, as the case may be. And the information on what it costs. Consent for medical photography, which is what I was saying, if they need to take a photograph to send to your doctor or whatever. So, so they do leave you a great big book here as well. They go over what medications you're on and what operations you've had and who's your primary doctor, etc., etc. So yeah, very thorough, very thorough. And while he was here, he took a look at my ostomy to make sure that everything was secure, and he said it looks really good, so we don't need to change it at the moment. So my first appointment will come Monday, and twice a week. And so I shouldn't have to have them for very long. It's just, like I said, really what I need is to find the right ostomy supplies, and so that I can be competent in changing it myself, because sometimes you have to build up, you may have a divot or something and you have to have where you build it up and then how to seal it in, and there's a lot of stuff to it that you have to learn. Okay, so what I have now in there for doing the change, I have my gloves, I have wipes in there, I have a little teapot thing that I put warm water in. It's got to be warm water to flush out, and really that is makes it so much easier. In the hospital, they, didn't flush it, and then you're trying to clean it out, and you take out as much as you can, but then it's kind of messy and difficult. But I found that, now I found this on YouTube, somebody was saying about that. And so I do have a little tea thing that when I go in to change it, I warm the water up first, put it in there, have my gloves on, have my little wipes out, and you open it and extract as much as you can and just pour in a little warm water and kind of, manipulate it and rinse it and do that twice. And then, you have a wipe and you clean it out and you fold it back up and you're good to go. And throw away your gloves. And so much easier that way than just trying to clean it out with a wipe or toilet paper or whatever. Oh, the other thing that they tell you to do, which is a big hint, is take 2 strips of toilet paper and you put it in the toilet first so that when it flushes out, it doesn't, you don't have it flying back up. You don't want that, you know. So that really does help as well, to put that toilet tissue in the toilet first. And so that keeps from having a splashback, which of course you don't want to deal with. But I think that really the hint about having some warm water and putting it in there and manipulating that, you can really get it thoroughly emptied, and so much easier to deal with and clean than it is without it. So I have those supplies already in there, you know, in a bag in there that I can dispose of the handy wipes and the gloves and stuff, you know. So I have that. All of that stuff is right close by, so that I can go in and take care of that, and that works quite well. So yeah, that's where that's at. Now I've got to get my book and start writing these appointments down, because I have it, I think, the 1st, the 2nd, the 30th, and I'm just like, I've got so many appointments. I just don't even know, you know, how I'm going to do all of this. It's insane. Oh, Miss Lily, do you have a treat? Do you have a treasure? Did Ronald give you a treasure? Oh my goodness, happy girl. So anyway, I'll leave that here for now. But that's what happened when the home health care nurse came up today. We went through everything, was very, very thorough. And so, yeah, that's what I signed up for, because I don't need all this extra care. I need minimal just help with that, and the rest of it is fine. So on that note, I'll leave that here, and we'll see you online.